The new health insurance bill may be new to South Africa, but some countries such as Thailand and Ecuador have introduced universal coverage reforms since the early 2000s. The NHI Bill, passed earlier this month in South Africa, has been widely criticized for various reasons. Some of those reasons is it being flawed. Let's take a look at the bill from a global perspective and how other countries are succeeding or getting it right. Executive Director at the Center for Universal Health at Chatham House, Robert Yates, is in the country advising stakeholders on the NHI Bill in South Africa, and he joins us now to weigh in on the discussion. Thank you very much, Robert, for your time. Well, for at least the amount of healthcare workers we've spoken to here on the channel, it's not the what, it's the how that is an issue for them. From your interaction with various stakeholders, how do you read the room where NHI is concerned?
Well, certainly that it's an excellent idea, and South Africa would be very much following the global trends towards a universal health system that's predominantly publicly financed. That is the best way to ensure that everyone gets the health services they need with financial protection. But as you're saying, the process of getting there can be quite complicated and does require change, and people are often scared of change and resistant to change. But my reading is that the strategy as put forward is a very sensible one to be using, as I say, mostly public financing, but purchasing services in both the public and the private sectors. So I think a lot of the fears are really unfounded and will be proved to be not correct.
Which fears can you identify? For instance, a healthcare professional was speaking about the Minister of Health, for instance, having the authority to appoint the service providers. And so that's just but one of the concerns that they have. Also taking a look at South Africa's medical aid industry, which is something that has been an issue of contention, especially when you take a look at the access to healthcare.
Sure, and I think it will be a big public debate as to what will be covered in the NHI benefit package, and these are exactly the type of debates we have in the United Kingdom around the National Health Services. And as new technologies come along, a decision is taken as a country as to whether we can afford, such services, but for everyone. But of course, then there is still scope, outside the NHI, for particularly expensive and maybe not particularly cost-effective treatments to still be available. So it certainly isn't the case that everything will sort of get shut down that isn't in the NHI.
I'm not quite sure the makeup of the United Kingdom's healthcare system, but in the country, I'm sure this is something that you are aware of, where we have public healthcare facilities that are not where they need to be, not nearly. And so that has been another concern from some sectors of the population to say if we all bandy about it, again, it's not an issue of whether NHI should be implemented or not. It's an issue of how, and the matter is in the how it is done. And so maybe looking at your setup and the setup of other countries that you have noticed, the public healthcare system, is it in a good condition?
Well, it can certainly be improved, and I think that goes for pretty much every health system, especially those that have been hit so hard with COVID, and it will require extra investment and looking at health workers and medicines and facilities. Undoubtedly will need more financing. But I think if you take a step back and look at the total quantity of health financing in South Africa, which I think is about 8.5% of GDP, that should be perfectly sufficient to provide a universal package of services for everyone. So I think it is a case that, some of the money that is, you might say, locks up in the medical schemes at the moment, over 4% of GDP, were that made available to the public sector as well, then the quality would improve.
Okay. Maybe let's take a look at what other countries are doing. Was there resistance initially?
Yes, definitely, and it is often from vested interests who quite like the old system, that they feel that they get the health services they need, and aren't perhaps prepared to pool their resources to make sure that everyone gets the health services they need. So this has been the case right across the world. But the good thing is, I think that once you do have a universal publicly financed system that satisfies the vast majority of the population, it does actually prove very popular and robust, and certainly our NHS, that is going to be celebrating its 75th birthday next week, is one of the UK's most popular institutions. But we're not alone in doing this. The Japanese are very proud of their publicly financed health system. The Thais are very proud of their system as well, and the Australians likewise. So it is something that once you've sort of got over the political opposition and you have implemented it successfully, that it's very, very popular and therefore very sort of resistant to further change. It's very, very unusual. In fact, I can't think of any examples of countries that have gone away from a publicly financed system back to a privately one.
Did they face a shortage of nurses?
Well, you might say that all health systems, are constrained, and that we've had the situation that we have big problems around the interaction of healthcare and social care, and we have a shortage of workers at the moment. And in fact, our NHS is just about to produce a workforce plan, I think, next week. So, this is one of the big issues, and certainly as countries get wealthier and people live longer, as a proportion of GDP, they will need to spend more on health and social care. So it will always be some type of political battle, really, to make sure that those resources are available.
So how does it typically work, maybe for somebody who is really curious, for somebody who goes to, in your side of the world, who goes to, or from your side of the world, who goes to a healthcare institution? Walk us through the process. Let's say Robert is not feeling so well. You go to the hospital, and then what happens?
Well, you don't tend to go directly to the hospital. I mean, unless you're very acutely ill. Obviously, if you have chest pains, you call 999 and you go to A&E. That you're admitted straight away. But typically, and this is very important around having sort of gatekeepers, trusted family doctors, and that you can go to in the first instance. And certainly it's the case in the UK. Practically everyone is registered with a GP, and that 9 times out of 10, your first port of call will be the GP, who will usually be able to treat you themselves. But then occasionally you'll require a referral, and at that point they will refer you to a hospital. And that tends to be in the public sector in the UK, because we are very public sector dominated. But then there are many other countries, like sort of Japan and France, where you'll get referred to a private hospital. Virtually all the providers are in the private sector. And so I would envisage here in South Africa, in fact I know that the NHI plan is that chances are you'll have a choice of, do you want to go to a sort of a nearby public hospital or a private hospital, and it will be up to you and your doctor to decide where you want to go.
There's also another conversation, not only in South Africa but on the continent, about some healthcare professionals who then get poached by the likes of the United Kingdom. Why do we see the country importing some of the healthcare workers?
Well, it is undoubtedly the case. There is an international market for healthcare workers. I mean, all across the world, people want more healthcare, and therefore there is this pressure to make sure that you pay your health workers properly, and avoid this situation of them going overseas. And this is very, very relevant in the United Kingdom at the moment. You might have heard that some of our doctors and nurses are on strike at the moment, and a lot of them are talking about going to Australia and New Zealand. And these strikes need to be resolved, and I'm sure they will do in the next year. But this is, why I think it is very important for everyone who's concerned about healthcare to make sure that your valuable health workers are paid properly.
Robert Yates, Executive Director at the Centre for Universal Health at Chatham House. Thank you very much for your time this afternoon.